Welcome to ALH 3, Chapter 30, Lecture for Drugs for Mental Health and Behavior Disorders. Our learning objectives for this lecture are describing mental health and deviations diagnosed as mental illness, identifying medications used to treat anxiety, recognizing medications used to treat psychotic diseases, identifying principal signs of depression and drugs used as antidepressants, recognizing agents used as anti-manics and for bipolar disorder, describing behavioral disorders found in adults and children and drugs indicated for treatment, understanding role of medications in treating Alzheimer's disease, identifying drugs for attention deficit disorder and attention deficit hyperactivity disorder, providing patient education for compliance with medication used to treat conditions and disease of mental health and behavioral disorders. So look at this slide for mental disorders, common signs and symptoms. There's stress, anxiety, depression, withdrawal from society, disorganized thinking, hallucinations, inappropriate or violent behavior, crying, mood swings, sleep disturbances, fatigue, and agitation. The ability to cope with different types of stressors at different times of life is part of normal living or mental health. Some common signs and symptoms continued: loss of concentration, inability to experience pleasure, forgetfulness, inability to place self and environment, person, or place, and paranoia. Some mental disorder medications and common side effects for them are hypertension, restlessness, tachycardia, dry mouth, decreased motor and cognitive abilities, alterations in sleep patterns, and they tend to sometimes have a hangover effect, so you're constantly feeling like you're hungover. Also, increased or decreased libido, impotence, dizziness, drowsiness, confusion, extrapyramidal symptoms, and tardive dyskinesia. And tardive dyskinesia is a neurological disorder. It's characterized by involuntary movements of the face and jaw, and it can be from long-term use of some of the drugs used to treat. So mental health is a person's physical, cognitive, affective, behavioral, and social being. Medications play an important role in modern psychotherapeutic care, and drugs temporarily modify behavior. Psychotherapy can permanently change behavior as well. And it's important to note that, as in your discussion board this week, that there are different definitions for mental health, and it's something that overall can cause confusion even in different cultures or different towns. Lots of people look at mental health definitions differently, and it's been a stigma to talk about mental health, but mental health is a part of our health, and it's something that we need to get rid of the stigma and talk about and really understand for ourselves and for our patients. Proper diet, exercise, a pleasant environment are all important in treating any emotional disorders. Some mental health characteristics: accurate perception of reality, ability to accept oneself and others, ability to be spontaneous, need for privacy, independence or autonomy, and ability to express self emotionally. So when we have good mental health, we're able to do these. So these characteristics are of a healthy person. And this is described by Abraham Maslow. And I think you've probably, because you did anatomy and physiology, and as well as MedTerm, and even within our discussions, you have probably seen Maslow's hierarchy of needs. This basically states that we need to start at one need and build to the next, and we have to have the need met before we can progress. For example, our physiological needs such as food, water, warmth, and rest, we must have that before we can move up the pyramid to our safety needs, which is safety and security. And then the next is belongingness and love. Then the next part of the pyramid is esteem needs, and then self-actualization is at the top of this pyramid. So also for mental health characteristics in a healthy person, frequency of peak experiences, identification with humankind, ability to maintain satisfactory relationships, sense of ethics, and some sense of resistance to conformity. And also from Maslow is that peak experience. And the peak experience is described as moments of highest happiness and fulfillment. So we need to have those moments in our life where we're happy and feel fulfilled in order to have healthy mental health. Some mental disorders, we have neurosis, which is abnormal behavior due to increased anxiety, tension, and emotional imbalance. We have psychosis, which is a mental illness accompanied by bizarre behavior, altered personality, and failure to perceive reality. We have anxiety, which is a major motivating factor in one's emotional life. Anxiety is a major motivating factor in a person's emotional life. And the way that person handles anxiety from mild anxiousness to a state of panic is the ultimate sign of their mental health. If they're able to take a higher level of anxiety and kind of handle it and have coping mechanisms, versus somebody who is struggling in this area might have a mild form of anxiousness and not be able to filter it out and calm themselves down from the anxiety. Drugs for anxiety. So the drugs are known as anti-anxiety agents, anxiolytics, or minor tranquilizers. Elderly patients generally require lower doses due to excessive sedation and reduced elimination of drug. Do not combine alcohol with anxiolytics, and drug of choice are the benzodiazepines, buspirone. Anxiety disorders are chronic conditions, and therefore they require prolonged therapy, both drug therapy and psychotherapy. Self-administered medications such as antihistamines and cough medications can cause excessive sedation when combined with anxiolytics, and the potential for abuse and addiction is high when tranquilizers are used for a prolonged period of time. Benzodiazepines, they're safer than other barbiturates. They can cause severe respiratory depression when mixed with other central nervous system depressants. They have adverse effects, daytime sedation, amnesia. Transient insomnia treatment should be intermittent. You should only use for 2 to 3 weeks. And contraindicated benzodiazepines are contraindicated for pregnant women or persons with sleep apnea. Take caution for persons with suicidal tendency. All benzodiazepines have the same pharmacologic action. Selection is based on the duration of action. Here is a list of selected anti-anxiety medications. Some that you might be familiar with would be Xanax or Valium, Centrex. So antipsychotic medications are also called neuroleptics and or major tranquilizers. These relieve symptoms of psychosis or severe neurosis, delusions, hallucinations, agitation, combativeness. They're used therapeutically to relieve nausea and vomiting. They're used to potentiate the analgesics, and they're classified by potency, by the strength of the medication. What are two forms of psychosis? Two major forms. If you thought schizophrenia and severe depression, that would be correct. Some side effects to the antipsychotics is the postural hypotension, tachycardia, bradycardia, vertigo, dry mouth, blurred vision, fever, constipation, urinary retention, anorexia, and jaundice. Major indication for the antipsychotics is schizophrenia. Long-term use can cause extrapyramidal effects, tremors, dystonia, which is slow, irregular, involuntary movements of upper extremities. It's important to note that elders are more prone to the Parkinsonian symptoms and children are more prone to the dystonic reactions. So here are some selected drugs for psychosis: Tylenol, Thorazine, Prolixin. And there are several more. Those are ones that I'm more familiar with. Vesprin, Haldol. The objectives for schizophrenia treatment are to suppress acute episodes of psychosis, to prevent acute exacerbations of the disease, and to maintain the highest level of functioning for the patient. Let's look at depression. Depression is a common psychiatric disorder. It's feelings of intense sadness, helplessness, worthlessness, and impaired functioning. It might be exogenous, so it resolves after a period of time, or it might be endogenous depression, and there's no external cause here. It can be a result of genetic factor or a biochemical change in the brain. What are some symptoms of major depression? We would see depressed mood, loss of pleasure, loss of interest in usual activities, and some possible causes of endogenous depression may be genetic, like I said, or results of the biochemical changes in the brain. And these are the ones that we typically see long term, and we're looking at drugs that they will be taking more long term. Antidepressants. Response to medication usually occurs within a few hours. The full effect can take about 2 to 4 weeks to actually kick in. Therapy should continue for 6 to 12 months following relief of symptoms. So even after they have relief, and sometimes a patient will feel like they're feeling better, it's the cause of the actual antidepressant. So therapy should continue for 6 to 12 months. And evaluate the client for suicidal tendencies. It's very important to make sure this evaluation is done. There are 3 major classes. They are monoamine oxidase inhibitors, or MAOIs, tricyclic antidepressants, or TCAs, and selective serotonin reuptake inhibitors, SSRIs. TCAs may cause sedation or orthostatic hypotension, dry mouth, and constipation. And MAOIs and TCAs may cause the orthostatic hypotension. MAOIs have many drug and food interactions, and I want you to make sure that you take a look at that in your book. And let me find out. I'm going to pause this for a second and find the page with the green box that I want you to take a look at. Hold on. So it's actually the light blue boxes with the dark blue tables, and it's table 30-4 in your book and table 30-5 that relate to this, and you can find this on page 572. Please take a good close look at that and take some notes. Let's see, where was I? The SSRIs have fewer side effects, and SSRIs may cause insomnia, nervousness, and sexual dysfunction. So it's important to note that antidepressants must be taken on a daily basis, and they need to be taken daily and regularly. It's also important to note that TCAs and MAOIs cannot be combined because of the danger of hypertensive crisis.